Lumbar spine fractures refer to breaks or cracks in the vertebrae of the lumbar region. These fractures can result from a variety of causes, including traumatic events like falls, motor vehicle accidents, and sports injuries. The lumbar spine bears a significant portion of the body's weight and allows for flexibility and movement, making it a critical area for sustaining normal posture and function. Clinical evaluation includes a thorough examination of the back for pain, tenderness, and deformity, along with a neurological assessment. Imaging studies, X-rays, CT scans, and MRI are essential for diagnosing lumbar spine fractures, assessing the extent of the injury, and planning treatment. The X-ray here shows burst fracture of first lumbar vertebrae. The stability of lumbar spinal injuries. It is the same as for thoracic spine injuries. Assess three key components: the injury's morphology, the integrity of the posterior ligamentous complex, and the patient's neurological status. This CT depicts a compression fracture which is stable. This is an unstable burst fracture with malalignment of the three columns of the spine. Axial loads cause compression or burst fractures. Thoracolumbar junction signifies the transition from the immobile segment of the spine to the more mobile lumbar spine, which predisposes this area to be more susceptible to fracture dislocations. Lumbar fracture management is conservative with stable fractures and surgical with unstable fractures. Early mobilization is important for all lumbar fractures. The aim of surgical stabilization of the lumbar spine is early mobilization to result in faster healing and reduced pain. Here is a burst fracture of the third lumbar vertebrae and a postoperative X-ray after fracture fixation. Spinal fractures are commonly associated with high-velocity blunt trauma. Diagnosis based on the presence of pain and tenderness and associated neurological deficit. Confirmed by radiographic evaluation, CT is the modality of choice. Management depends on stability.